Microorganisms encountered in blood. Microorganisms present in the circulating blood, whether continuously or transiently, are a threat to every organ in the body. Invasion of the bloodstream by microorganisms, aside from the problem of disseminating infection and involving and affecting the functions of implanted foreign bodies. For examples, artificial heart valve and joints may have serious immediate consequences, including shock, multiple organ failure, disseminated intravascular coagulation (DIC) and death. Thus, bacteremia constitutes one of the most serious situations in infectious disease. The expeditious detections and identification of a bloodborne pathogen is one of the most important functions of microbiological laboratory. Positive blood culture may help provide a clinical diagnosis as well as a specific etiological diagnosis. Pathogens of all four major groups of microbes like bacteria, fungi, viruses, and parasites may be found in circulating blood during the course of disease. The bacteria, on the other hand, may also be recovered from the peripheral blood in the absence of disease. After any loss of the integrity of capillary endothelial cells, a few bacteria may enter the bloodstream and live for a short time until the primary defense systems of a healthy host phagocytic cells in the liver and spleen, polymorphonuclear leukocytes and antibody and complement destroy them. Eukaryotic parasites may also be found transiently in the bloodstream as they migrated to the environment of choice. Their presence, however, cannot be considered to be consistent with a state of good health. The kinds of microorganisms isolated from the blood culture vary accordingly to the patient population served by an institution. Parasitic infections. Pathogenic mechanism. The parasites that infect cellular components may cause disease by disrupting the normal functions of infected cells. The invasions of phagocytic cells of the reticuloendothelial system has occurred in visceral leishmaniasis renders those cells less able to fulfill their role as a non-specific immune responders. The proliferation of infected mononuclear phagocytes in the liver, spleen, and bone marrow leads to enlargement of liver and spleen and contributes to anemia and leukopenia seen in patients with this infection. The primary growth of Trypanosoma cruzi in the human host occurs in various host cells that are initially penetrate. When the parasite matures to tripo, tripo, trip, tripomas tigot stage and burst out of the host cells, a generalized parasitemia results, although able to multiply in any organ. The organisms prefers to invade muscles, including heart muscles and nerve tissue. The cycles then repeats itself. Damage to the host is probably due to death to its own inflammatory response, attempting to localize or destroy the infected tissues, and to rupture of host cell during the release of tripomastigotes. The most important consequences of the disease are congestive heart failure and cardiac arrhythmias related to cardiac muscles and its conducting tissue involvement, and dilations of esophagus and colon related to the neuronal involvement. Tachyzoids of parasite Toxoplasma gondii may be found in circulating blood. They invade the cell within lymph nodes and other organs, including lungs, liver, heart, brain, and eye. Resulting cellular destructions accounts for the manifestations of toxoplasmosis. Malarial parasites invade host erythrocytes and hepatic parenchymal cells. Cerebral malaria is especially dangerous. The significant anemia and subsequent tissue hypoxia that may result from destructions of red cells by the parasite are a major cause of morbidity. The host immunological response is to remove the parasites and damage red blood cells. The immune response may also have a deleterious effect, although microfilariae are seen in peripheral blood during the infections with Depitaloneuma, Mansonilla, Lolo, Boucheria, or Brugia is the adult worm eliciting the inflammatory response, the primary in lymphatics that causes the distinctive lesions of filariasis related to the lymphatic obstructions. Detection: the parasite in the bloodstream are usually detected by the direct visualization. Those parasites for which diagnosis is routinely depend on observations of the organisms in peripheral blood smear, including Plasmodium, trypanosoma, and Babesia. The patients with malaria or filariasis may display a periodicity in their episodes of fever that allows the physicians to time the collections of blood for visual examinations of parasites for optimal result. Further, the discussions of the life cycle of blood-borne parasites and techniques for examination of blood for their presence can be found here. The serologic test for the diagnosis of infections due to the blood-borne parasites are also useful.